there's so much emotion and all this stuff attached to it, and it's really hard to kind of break through all that noise. And that's actually another thing that the GLP-1s do is that and I've seen this in patients who have like binge eating tendencies, is that it really removes a lot of the food noise in their brain. It kind of helps them
Mhm.
separate and be like, okay, like I don't need to eat till past satiety. I can just eat a regular amount of food or a little bit less amount of food and be totally fine with that.
All right, Mary, I am so excited. Today is our first episode with our first guest. We have Dr. Rao here today. She is a quadruple board certified physician in internal medicine, gastroenterology, obesity medicine, and lifestyle medicine who focus on digestive disorders, gut health, the microbiome, obesity medicine, and women's health and wellness. She received her undergraduate degree from the Massachusetts Institute of Technology, after which she graduated from Duke University School of Medicine. She completed her internship and residency in internal medicine from the hospital at the University of Pennsylvania. She went on to complete her fellowship in gastroenterology at Boston Medical Center. She's a clinical assistant professor at Tufts University School of Medicine and managing partner at Integrative Gastroenterology Consultants, where she leads the Metabolic and Lifestyle Medicine Clinic. She also focuses on disorders of the esophagus, irritable bowel syndrome, and anorectal disorders. She's passionate about empowering women to improve their health through sustainable changes in their lifestyle and runs an intensive lifestyle medicine curriculum through her office. Outside of work, she spends her time educating via social media, cooking healthy meals with family and friends, traveling, and being outdoors. Oh my gosh, Dr. Rao, you're putting us all to shame. That was the best introduction in bio. Thank you so much for being here.
Thank you so much for having me on this podcast. Very excited to talk about the topic today.
Yeah, we're talking about
Yes.
GLP-1s, and it's a hot topic. And these drugs, of course, the most popular one being Ozempic. And we had a lot of reader questions come through. We have a lot of background we want to cover just to give everybody a little bit more information about pros and cons. And we're really looking forward to a good conversation about it.
Yeah, like you said, the
Yeah.
GLP-1s and like Ozempic especially kind of was like both like, famous and infamous in just how it was treated in the media. But these medications have really changed the landscape of obesity medicine care. And I'm just really excited to kind of, demystify some things about these medications and just talk really frankly about, how we use them and what, purpose they serve.
Perfect. That's exactly what
Yeah.
we're
So
looking for.
exactly, exactly. I get so many questions around GLP-1s given that they are in the media so much lately. Can you explain what exactly they are? What do they do in the body? And why is everyone talking about them right now?
Sure. So GLP-1 basically is glucagon-like peptide 1, and it's a hormone that we produce in our body. So we already produce this, our gut produces it, and then it has a lot of downstream effects. So the GLP-1 agonists, which are like Ozempic, Wegovy, all the injectable medications, Mounjaro and Zepbound, they act similar to this hormone, and they bind the receptors on cells in like the pancreas and the GI tract and the brain. And then it sends like a series of downstream effects, just like the endogenous hormone would. And so what happens is we get increased insulin secretion. So our insulin levels go up and it actually improves insulin sensitivity. It delays gastric emptying. So our digestion slows down a little bit and that leaves us feeling fuller over time. And then it also helps to kind of reduce our appetite. It works on pathways in the brain and the arcuate nucleus, basically. And that kind of sends us down the pathway of satiety. So we're going to feel like we have a reduced appetite. And it actually helps improve lipid metabolism as well. So it has like a lot of amazing effects. And this is why actually Ozempic these medications were initially used to treat diabetes because they do such a good job in improving insulin sensitivity. But then over time, they saw that people were losing actually a reasonable amount of weight on these meds. And so they were studied further to see, do they have efficacy with weight loss? And then the results were mind blowing. All the medications we had up until this time were these oral meds that had a lot of side effects that really didn't have huge amounts of weight loss associated with them. But once these were studied and the trials came out and everyone saw the data, they saw it was really impressive with weight loss.
So is it fair to
Wow.
say they're kind of being used off label for weight loss? That's not the original intended purpose. And how does that sort of play into the efficacy?
So Ozempic, which is semaglutide is kind of like the, generic name of it. Semaglutide was initially studied as Ozempic for diabetes. Then actual trials were done for weight loss. And then once they saw it did do it, they rebranded semaglutide as Wegovy. So Ozempic is used for diabetes. Wegovy is used for weight loss. If you use Wegovy, it's not off label or anything like that. It's actually been approved by the FDA for weight loss. Same thing, Mounjaro and Zepbound. Mounjaro was used for diabetes control, and then Zepbound is used for weight loss. They're both targeted for those two specific reasons, and they're both FDA approved for those two reasons. Yeah.
Mm.
So even though they're the same exact thing, Ozempic and Wegovy, there's no difference between the two. They're both semaglutide, and Mounjaro and Zepbound are both tirzepatide. They're the same exact medication, but one is used for diabetes and one is used for weight loss.
Interesting. Good.
Is the weight loss version something that's newer, though, on the market, given that they recently found out that
Sure,
weight loss is a
yes,
side effect?
exactly. So
Okay.
Ozempic was around a lot longer before Wegovy was on the market, and same thing with Mounjaro and Zepbound.
Got it. Got it. Okay. So the intent originally was used for diabetes, and then these other two are now marketed towards
Yeah, so
specifically
like a
weight
few
loss.
years ago when there was this whole Ozempic craze and people were like using it off label, I mean, technically Wegovy came out and was used as weight loss. So, I mean, to say it was used off label, yes, I guess that's true. I think it was more abused in the sense of like when people were trying to lose like 5 or 10 pounds, as opposed to the actual indication that these drugs have. It's for patients who have obesity, who have, cardiometabolic disease like diabetes, like sleep apnea, like high cholesterol, high blood pressure. And if you're a Hollywood star trying to lose 10 pounds, this is not the way I would do it. So,
Mm,
Yeah.
that's really interesting. Go ahead, Mary.
Yeah. With that said, because I'm wondering if you specifically are using it for metabolic syndrome or diabetes specifically, does it have a different action if, say you do have a significant amount of weight to lose, but you do not have perhaps like a metabolic syndrome condition? Are there more serious side effects involved?
yeah, so we found that I mean, that's a really good point, and that's why they studied it to see in terms of like the safety and efficacy of it. So yeah, it was really safe and efficacious in patients with diabetes. It lowered their blood sugars. It helped, reverse a lot of the issues that they were having. But then when they looked at it for weight loss, they saw that actually, even if you don't have diabetes, but you have obesity, you would lose that weight safely and your blood sugar levels really wouldn't be affected. You're not going to all of a sudden have like super low blood sugar levels. And the mechanism behind that, I think, is still kind of being studied, but basically people are able to tolerate it. And if you don't have any cardiometabolic disease besides having obesity, you're still able to take the med safely, as long as you're taking it under the supervision of a physician who knows how to administer these medications safely. In terms of side effects, the most common side effects of these meds are GI in origin, which is great because I know how to manage all GI side effects. So a lot of it is like nausea, vomiting, constipation, changes in bowel habits, that kind of bloating. Those are the main kind of side effects that we see. Very rarely, pancreatitis or inflammation of the pancreas can happen with severe abdominal pain. But that's pretty rare.
Hmm. Yeah, I had actually my mom go on Ozempic, and she more than qualified. However, she had some crazy intense side effects. One of them just being vomiting.
Yeah.
And obviously, you can't vomit for, very long without like risking dehydration or, getting admitted to the hospital. So are there people that just their body rejects it? And or how do they deal with those side effects?
Yeah, so I mean, it really, again, comes back to who is prescribing this medication. Is it someone who's prescribing the med and it's like, here, take this medication, keep going up on it until you like, continues to lose weight? Or is it someone who's like, okay, let's start at the lowest dose. We're going to keep you on this dose. We're going to titrate it up slowly. Let us know, like, we'll be in constant touch with you. Let us know if you're having side effects. Are you having nausea? Are you having vomiting? We have ways to kind of like get around that, either with certain, medications to help with mitigate some of those side effects, or, thinking about how your nutrition is. What are you doing food wise? Are you still eating poorly? And that's what's causing you to vomit, because these medications don't do well with the super high fat and greasy kind of diet.
Mhm.
So it really depends on how it's administered. And then you're right. Some people just can't tolerate these meds for whatever reason, the nausea and vomiting. Like I saw a patient who walked in She was prescribed the medication by another physician, didn't really follow up. She'd lost like 50 pounds, looked so weak because she was just vomiting almost every day, to the point her blood pressure when she came and saw me was like 60/40. I had to send her emergently to the ER to get this managed because she wasn't being managed appropriately. But I don't think I would necessarily put her back on those meds because she didn't do well anyway. So yes, I think it's like a kind of very fine line to walk in terms of how to manage the side effects really carefully, and then learning when to like be like, you know what, you've given it the old college try. We've done the best we can, but I don't think this med is right for you. And then trying to figure out another avenue to pursue.
So with that, and in kind of coaching people through their lifestyle habits and changes and their diet. So one of the biggest side effects I've seen from people that I've worked with too is they're not properly managing their diet. They're not getting enough protein. Then they come off, they might have muscle wasting, and then they just get kind of a rebound weight gain effect too. That might be a two-part question, but I'm curious to hear.
Yeah, so definitely. So I have patients who are like, they walk in and they're like, I just want the shot and that's what I want. And I don't really want to change anything else about like the way I'm doing anything. That's not the way it's not going to work out well, because if I think of these medications as just one like tool in the whole toolbox of weight management and like helping your metabolic health. In addition to that, it's like how you're eating, how you're exercising, how you're sleeping, what your stress levels are like, all these other, like, who do you surround yourself with? Do you drink alcohol? Do you smoke? Like all these different things matter. And to say that like, I'm just going to do this and not do anything else, like I will not be inclined to have you as a patient, because like to me, that means that you're not really understanding the point of these medications. So I make sure that when I see these patients that they see a nutritionist. We have one in our office that we do. I also teach a lifestyle medicine curriculum where we really talk about food and like how food is important and how to approach food. And we have really big, like, long and intense conversations about that. And then I make sure that they're getting enough. I mean, for me, protein is important, but almost important or even more important is fiber, and making sure that these patients are getting enough fiber in their diet too. And if they're doing that and strength training a couple times a week, then I feel like, yes, these are the patients that I know are going to do well long-term, as opposed to somebody who just shows up, tries to do the bare minimum. They're not going to see as much improvement. They're going to plateau a lot faster. And, if they decide they're going to go off it, they're going to actually be worse metabolically because they will have lost some muscle mass in addition to fat. And then they're going to end up in a worse metabolic, state than they were previously.
Thank you so much for saying that. Honestly, like bravo, because I feel like so many people turn to these drugs and, like you said, don't want to change anything else about their lifestyle, or maybe they even haven't tried to put in the full effort in terms of weight loss, and they're just like, I just want to do this because everyone else is doing it and it's effective and we're seeing that it works. And as a dietitian, I cringe because I worry about the sustainability and the long-term side effects. And so I'm curious, those patients that you have that are doing everything that you just mentioned and they're doing it correctly, is there a chance that they can then get off of these meds and sustain that weight loss?
So these meds are approved for long-term use. Most of the patients I have who have done very well on them have stayed on them. And the ones who have made those really intensive lifestyle changes, I've been able to cut back on their dose a little bit, and they've still been able to maintain. Like, for example, I have a patient who started off, pre-diabetic, high blood pressure, chronic pain in knees because she had obesity, and she lost over 100 pounds on these meds while following a more plant-based diet, increasing her plant-based protein, increasing her fiber, finally able to exercise because her chronic pain was gone, increasing her weight training. She's now a Zumba instructor. She's done amazingly. And we've been able to come back on her Wegovy dose because she has made such intensive lifestyle changes that we were able to do that.
So would you say you see more success maybe with kind of titrating down on the dose, but not necessarily pulling someone off it all together?
Yeah, because at least as of now, I haven't had any patients who've come off completely, unless they were patients who had more cardiometabolic disease. That was the reason that they got the medication approved as opposed to weight loss only. Those patients I've been able to get off with intensive lifestyle changes as well. But overall, the patients who I have on it who've done well are still on it, but maybe at a slightly reduced dose too.
Mm. Well, that's really interesting. I actually didn't know that. It sounds like you should probably, like you said, just titrate them down rather than just completely
Just completely
eliminating
come
it.
up. And if someone is interested in
Yeah.
coming up, I definitely work with them and like, very slowly have them come off. And then we can, see how they do. I have a couple patients who are in the process of doing that because they feel like they've made all the lifestyle changes. They really want to see if they can do it without it. So I'm willing to experiment like that with them. And so we'll see.
Mm, mm. And you had mentioned, fiber, it sounds like being even more important than protein. Can you explain why that is?
So fiber to me is important. In terms of muscle building, yes, protein is really important. Strength training, resistance training is very important. Fiber, as a gastroenterologist, especially, we don't have as much of a protein deficiency in this country. I would say we don't have a protein
Yes.
deficiency at all in this country. But we have a fiber deficiency. 97% of people in the US do not get enough fiber in their diet. We're supposed to get on average 35 to 40 grams of fiber in our diet every day. We're lucky if most patients get 10. And that's usually in the form of like fries, or like, things that aren't like super healthy, that they just happen to get a little bit of fiber, from a or a bite there of something. And because they end up taking like Metamucil or something on top of it.
Yeah.
Fiber
Yeah. And I completely agree.
yeah, fiber is kind of like when we ingest a lot of fiber, the gut bacteria that we have in our colon ferments that fiber, produces compounds called short chain fatty acids. So those are like acidic compounds which help kind of maintain our gut health and are actually really important in reducing inflammation, whole body inflammation. And so it helps reduce the risk of, elevated cholesterol, blood pressure, diabetes, heart disease, fatty liver, like neurologic disease. And so when you're thinking about whole body inflammation, fiber is kind of like the key to all that, because when fiber is being fed to the gut, it's basically making these short chain fatty acids, which then trigger downstream effects of other substances to reduce the inflammatory response. And so whereas if you have a diet that's super high in saturated fat, super high in animal protein, it's much more inflammatory because you're getting the buildup of plaque in the arteries, increased inflammation that you see. And so that's why, the United States has such a problem, because we're so focused on saturated fat in this country and like animal protein. So
No, that's why I'm so
Yeah.
fascinated to see kind of the longer term effects of the carnivore diet craze and what their microbiome is going to look like in 5, 10 years. I mean,
anyone tells me about the fucking carnivore diet anymore, I'm just like so tired of like debunking the myth of the people come in, they're like, I'm keto, I'm carnivore. I'm just like, you're eating like marbled red meat. How is that good for your GI tract? It's not. It's so like, uh, it's a lot.
Wow. I have to say this because it's kind of crazy hearing all of this. So I used to work for a metabolic health company, a very major one. I'm not going to name who, but they
Ooh,
actually started they actually started to take on patients coming onto the program with GLP-1s, and their whole goal was to eliminate the GLP-1s.
Wow.
However, they are very not keto, but very low carb, very close to keto, very low carb. And so it's interesting, hearing you say this, that, we obviously, have a huge reliance on saturated fat in this country, and the protein, um, it's not necessarily like a myth, but it's like you said,
Yeah.
there's no deficiency of protein, there's a deficiency of fiber, which I completely agree with.
Yeah.
But they are trying to get people off of these GLP-1s, but with a heavy focus on protein, and specifically animal fat and animal proteins. So yeah, it's just it's interesting to hear your take on it, given
Yeah,
that
it's
it
really
may not be
interesting.
the best.
Anytime you make a huge change in your diet or like something, yes, you're gonna lose weight. Like everyone will see weight loss when they like go to that and they do a super low carbohydrate, like whatever they're trying to do. But that's not sustainable. You have to look and
mm,
see what diet you can do for the rest of your life. I'm sorry, nobody can do
Yeah,
that entire life.
ab-
You're gonna like
absolutely.
honestly, you're not gonna be able to poop. Like you're not gonna be
yeah.
able to do anything. Like your gut is going to be so angry at you that you're just going to be like, oh my God. And the moment that you start eating carbs, you're going to just all of a sudden balloon back up. So like,
Um,
people need to approach food in a much healthier way. I think if we are able to remove emotion from food and really think about food as just like, is this thing that I'm about to put in my mouth, is it something that's going to nourish me, or is it something that like down the road, past the 30 seconds of me hitting my like sugar receptors in my brain, is it going to hurt me or harm, like, is it going to harm me in the long term? Is it going to help me? Do I know that like putting this in, like, would I want to give this to my kids? Is this something that, you know, is going to fuel me to get through the day, or is it going to give me a sugar high, or like this, like, you know, 10 seconds of euphoria and I'm going to crash like in 30 minutes. So that's how I feel like we need to approach food in a much healthier way, because otherwise, like, there's so much emotion and all this stuff attached to it. And it's really hard to kind of break through all that noise. And that's actually another thing that the GLP-1s do, is that they, and I've seen this in patients who have like binge eating tendencies, is that it really removes a lot of the food noise in their brain. It kind of helps them separate and be like, okay, like, I don't need to eat till past satiety. I can just eat a regular amount of food or a little bit less amount of food and be totally fine with that. And so I think that is like another really good aspect of the GLP-1s.
Well, on that
Yeah, you know who
note,
talks
I
about
have also heard that somehow it may affect dopamine receptors in your brain, because people who have potentially addiction issues, alcohol, shopping, whatever kind of compulsive
Shopping.
behavior, just that was the podcast. It was like compulsive shoppers and people who have had potentially addiction tendencies have noticed that that has been quieted in their brain, sort of similarly
Yeah.
to what you were saying.
Exactly. Yeah. So there have been studies, like preclinical studies, like I think basically in like rodents and mice, because parts of the brain that drive our eating behaviors kind of overlap extensively to those same kind of like alcohol pathways as well.
Mm.
And so that like overlap that regulates overeating also kind of like looks at like substance use. So you can think about drugs, alcohol, all of that. And so the like suppressing that rewarding effect of alcohol by taking these meds has been, you know, shown to come to be true in preclinical trials. And so that's why they think that like this could be something like really, you know, earth shattering for patients who have alcohol use disorder. And actually, from my own experience in seeing patients who have issues with alcohol and smoking, they actually stop drinking
That's
completely,
fascinating.
which is so fascinating. And it makes me feel like there's something in terms of like these pathways that do overlap and make them just like be like, you know what, I don't need this. So
Hmm. Do we have long-term studies on GLP-1s, even for people, you know, that were on it for diabetes? I'm just curious, like, because you're saying that most people probably need to stay on this for life, it sounds like,
right.
unless they decide to want to come off themselves. But I'm just curious, like, do we have any data around what that looks like long term?
So, I mean, in terms of like weight management, I mean, they've only been around for a couple of years for that, but for diabetes, I mean, Ozempic has been around, I think, since 2010, I want to say. And so it's been around for
Yeah.
15 years, which is pretty good. And there are patients who have been on that med or some version of a GLP-1, whether it's Ozempic or Victoza or Saxenda, have been on some version of a GLP-1 without, you know, assuming that they were able to tolerate the GI side effects and without any other side effects really for it. So I think, you know, as time goes on, the data will continue to collect, and it'll be interesting to see, you know, how that all shakes out. But at least over the last 15 years in diabetics, it's been well tolerated without much issue.
Okay. Yeah, I think I was just coming from the standpoint of like muscle wasting that we hear
Oh, got
about
it,
a
got
lot, nutritional
it.
deficiencies because people eat so little,
A
right?
little,
So how
yeah,
are they
yeah.
actually getting all of their nutrients in
Yeah,
the
that
day?
that I'm not sure if has been studied necessarily, but you know, it's in mainly in diabetics. I would be interested to see, you know, I actually don't know the answer to that question, but it'll be interesting to see as time goes on
Yeah.
what's been studied with it.
Yeah.
Okay, I have a random side effect question. Ozempic face. What can you tell us about Ozempic face?
So Ozempic, I like remember being on like Instagram or something, and you will see everything on there. And I remember seeing something like, "What is Ozempic face?" And like, it's basically like, yeah, again, if you are taking Ozempic and losing weight at like an alarming rate, like more than 2 pounds a week, Ozempic face is just basically like losing the fat in your face and making it look all like droopy and people think you look older and whatnot. And so I think it's just, you know, has to do with that very rapid weight loss and
Mm.
almost like fat and muscle wasting in the face.
Mm-hmm.
which isn't a good look.
No.
Yeah, we've caught some celebrities already doing that
Some
look.
celebrities. Yeah.
Oh, yeah. I mean, there are a lot of celebrities out there who have obviously been on this, but again, using it for, using it for losing 5 or 10 pounds or something like that. But then, yeah, those who used it and didn't do anything else and had rapid weight loss, yeah, don't look so good.
Well, I wanted to also switch
Wow.
gears a little bit and talk about other specific conditions that the GLP-1s can be really beneficial for. So I keep seeing about microdosing for menopause, for other types of symptoms that may occur for women in menopause, perimenopause, specifically associated with like microdosing these drugs. And so what can you
Yeah.
tell us a little bit about that?
So I'm not a fan of microdosing. I don't think microdosing is what we should be doing. I would say that, as we get into women get into perimenopause, menopause, our estrogen levels are declining, and that can lead to changes in metabolism and overall can, increase weight, especially in the abdominal area, which then can, worsen our metabolic health. And so that increases our risk of heart disease, for stroke and for, fatty liver. And so if I would like to see the GLP-1s be approved for more conditions than just obesity, because like you're saying, they do have, great, efficacy in helping a lot of these issues. And so for patients my patients, for example, who are going through menopause, who all of a sudden have gained 20 pounds in the last, year, and whose BMI, allows them to get these medications, again, you're improving insulin sensitivity, which helps regulate blood sugar levels and helps you with weight loss. You're reducing inflammatory markers in the blood, especially if you're increasing your fiber intake. So that's going to help with weight loss and actually menopausal symptoms in general. And so I don't think that like you should microdose, because I think that's just dangerous and you just don't really know what you're doing when you do that. But I do hope that in the future that, these medications can be approved for more than just obesity and sleep apnea, because I think they do have a lot of wide-ranging effects, especially for women going through menopause.
Hmm. So
Are there
it's
any other benefits specifically to women other than just like menopause?
Um, I mean, so women, I think in terms of like cardiovascular health, I don't think that's obviously not specific to women, but I think that overall there's a lot more women nowadays who are suffering from cardiovascular disease. And so I think that, improved metabolic health, weight management, and improved cardiovascular health for women is really important and often overlooked. So I think these meds would be great for those situations.
Oh, awesome.
again brain health. I have come across some research, stroke prevention, brain health.
Mm.
Yep. So stroke prevention, again, because we're looking at inflammation. So because there are receptors kind of all over the body for GLP-1, it may help improve like blood vessel function, reducing inflammation. And so that blood vessels in our brain, and a stroke is basically either a clot in our brain or a bleed in our brain. And so they've been shown to basically reduce the risk of ischemic stroke in patients and can be protective. And so I don't think the mechanism is quite 100% understood, but there have been studies to look at GLP-1 receptor agonists basically reducing the risk of ischemic stroke. So that kind of goes hand in hand with both metabolic disease, because obviously if you have high cholesterol, you're going to have high cholesterol in your blood vessels, like in your heart, as well as in your brain. So it's going to be helping like all of that. And then also just brain inflammation as well. There's data to show that. So that those two together basically would, help in terms of stroke prevention.
Hmm. What about like depression risk in people specifically with diabetes, or even without diabetes? Is there any correlation there?
Yeah. So again, I think there's a lot of different reasons, because these meds increase our dopamine and serotonin levels. And so when those are, and actually, I don't know if you know this, but the majority of our body serotonin is made in the gut. And there are a bunch of
Yeah.
GLP-1 agonist, GLP-1 receptors in our gut. So you're stimulating the production of both serotonin and dopamine, and those are both involved with mood regulation. And so if you have increases in those, oftentimes like, you may have a little bit less depressive symptoms because of the up regulation of those neurotransmitters. Again, reduction of inflammation in the brain that, there's like something to posit that there could be some association with depression, with brain inflammation. And then if you're losing weight, some people have like a lot of depression and anxiety surrounding weight. And so if you're losing weight, you may feel better about those things. And so I think but then there's also the flip side, which, some people have had, suicidal ideations or depression on these medications too. So I think, it's hard to say. I think more research needs to be done, but definitely, at least in the serotonin levels that, have been increasing, there's data to prove that. But I think it's like a very complex relationship and still not fully understood.
Yeah, like probably many of the benefits I think that we're seeing in the media.
Yeah.
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 Well, it does sound like there are so many benefits here, and you seem very pro GLP-1s. I'm wondering what the cons are, really. We talked a little bit about pancreatitis and potentially people who don't have a lot of weight to lose using these drugs, but what kind of downsides are there, really?
So definitely they're completely contraindicated in patients who are pregnant or trying to get pregnant, just because you don't want to be on any kind of anti-obesity medicine while you're, trying to get pregnant.
Yeah.
For patients who have a history or a family history of medullary thyroid cancer, a specific type of thyroid cancer, I think in preclinical trials, like a rodent got thyroid cancer, and so we recommend that you don't take it. And also with like kind of like a specific endocrine cancer syndrome, it's called MEN1. So those are like kind of like the absolute contraindications. In terms of the other cons, again, like if you're unable to manage like the GI symptoms associated with it, like severe constipation, nausea, vomiting, to the point where you can't even, take food in at all, I would not use these medications. Yeah, those are the main things. Obviously they're really expensive too, right? If you're going to the companies and you don't have insurance, the least you can get them for is like $500 a month, which is not cheap. And so I think that's a huge barrier. And insurance companies, I don't think realized how amazing and popular these drugs would be, and are now like making people, jump through hoops to even get them covered by insurance. And so they're there definitely have been, a lot of controversies associated with it, but I think overall, in my book, they're a positive, I think they have a positive effect on our population. I think for the first time ever, obesity rates last year started to go down a little bit, and I think purely because of the introduction of these medications over the last couple of years. But that being said, I don't believe in the abuse of them. I don't believe in compounded meds. And actually, I think today was the last day that compounded weight made. And I think that, using them as part of the whole toolkit for weight management and metabolic health is like the way to appropriately use them.
That's really good to know. I have a random question. So, given that there are so many companies now creating, shall we say, these GLP-1 boosters. So, I'm seeing a lot of food companies come out with products that claim to help boost GLP-1 production, as well as supplement companies helping to boost GLP-1 production. Probiotics, I know right now, are kind of like this hot take on GLP-1s. So, I'm curious, how effective are these? Is it just kind of more for show? Is it marketing, or is there any kind of factual claims around this?
Yeah, so there are a lot of like supplements and foods that are out there that they say like, oh, they boost your GLP-1 naturally, and berberine, like, what do you do? I think the Kardashians, like I mentioned, they have like a supplement to promote GLP-1. And, some of these things may promote some GLP-1 production, but it's not enough to actually have like a truly sustained weight loss benefit. A lot of these things have not been studied, they're not regulated, so it's really hard to say with any certainty that they actually do anything. People talk about berberine, and berberine is this kind of like plant extract, and a few small studies have shown that it may help with reduction in body weight and waist circumference, but by improving insulin sensitivity. Again, it's very minimal amount. It's not like you'd see in some of these injectable medications like Wegovy or Zepbound. And so I know people really want to go all natural route and things like that, but I think that thinking about these medications as not natural or chemicals or things like that is not the way to do it. really work on the lifestyle. If you really care about that stuff, don't pump your body full of lots of supplements. Just take, an injection once a week if you need to do it. But, I don't think these, supplements and foods that purport, like, are even close to what they purport to do.
Sure. Yeah, that makes sense. I mean, medication is medication and food is food.
Mhm.
So it would be really hard to compare the two.
Yeah.
I was just curious because we do hear a lot about this coming into the media, and
Yeah.
you and I work with media outlets, and I
Right.
even have been approached by some supplement companies talking about how they want me to talk about this probiotic that features this GLP-1 mechanism, and I'm always like. I don't really know. Where are the
About
studies for this?
that.
Yeah.
Yeah, the science is not quite there, and that's the problem, right? It's, like, easy to get seduced by some of these things, and it seems so real, like, "Oh my gosh," like, like, it'll show a graph, and it goes up, and then, like, all this kind of stuff, and it's just like, "I
Yeah.
don't really know about that," but anyway, not to say that it can never happen, but I don't think we're at that point right now.
Yeah. Yeah. No, that's fair. That's fair. So just wrapping things up, we talked about a lot, which is awesome. I think there was some really great nuggets in here. I guess the main thing I would like to kind of sum up for people is for those who are thinking about going on a GLP-1, whether it's Ozempic or something else, what should people really know before jumping in, and what is like the takeaway?
Yep. So it's really important. I think you need to sit with, someone who's really well versed, either an obesity certified physician or someone who's been, administering these meds to patients in a really good way, good work, like, but has both your kind of mental health and like physical health, the whole package really, thinking about it. I think you really need to understand the side effects and like just not go into this blindly and think like, I'm going to have no issues at all. Like a lot of people have no side effects, but there are quite a few who do. And so understanding the side effects, understanding your family history, with regards to certain cancers, making sure that there's no contraindication. And understanding that this again is just one piece of the puzzle. There are so many pieces to help you on your weight loss journey that you really need to think about and really kind of inwardly think like, why are you doing this in the first place? What is your why? And if you keep coming back to your why, and I have patients who say, I want to come off meds. I want to, reduce my blood pressure med. I want to be able to, if I like, sit on the ground to be able to get up without having, someone help me. All these different, reasons why. Think about why you want to do it. And I think if you're able to understand truly the reason of doing, if, going to potentially be on one of these medications and changing your lifestyle, I think that is going to help you the most because instead of just saying like, oh, I want to look a certain way. And there's nothing wrong with that. There's nothing wrong with that at all. But really
Yeah.
thinking about your overall medical, metabolic health, I think is a way of looking at it as opposed to something completely physical. So
Yeah, I mean, and like what you were saying earlier, it's so much more than just someone, being concerned about their weight. And if
mhm.
it comes from other factors, that's probably going to help them sustain it, right? So they're
Sustainably, yeah.
also probably much more motivated to work out, to lift weights, to sleep better, to eat better, to do all the things that this medication requires of them.
Exactly. And that's what I want people to think about. I want people, to me, I just want like a healthier population. That's all I care about. I want people to feel better. I want them to have more energy. I want them to be sleeping better. I want people to be eating more plants. I want all of those things. And if these meds are a way to help patients get there, then that's 100% fine with me.
I love that. It's so beautifully said. Well, thank you
Thank
so
you.
much for being on today. I really enjoyed this conversation and getting to know you better. Is there anything that we didn't cover that you feel like you wanna just shout out?
No, I mean, I think we covered a wide range of topics today. Thanks so much for having me on. I love talking about these meds and, how I take care of patients and, just make sure, if you're a patient, just advocate for yourself and, find someone who you really have a great relationship with because that kind of trust is really important, in seeking a physician to help you on your weight loss journey.
Amazing. Thank you again.
Thank you so much.